I'm Rob Sykes with Team Surgical, and this is one of your Philips OnSite automated external defibrillators. This unit is very safe, very reliable, very durable, and also easy to use. Our hearts are right about here, okay? And all of our hearts in this room are doing some version of this. We might have heart murmurs, we might have arrhythmias, but all of our hearts are receiving an electrical signal right about here, and that's being transferred through the heart, and that perfuses or pumps blood through our bodies. The reason I know everyone's heart is doing some version of this is because we're all conscious, okay? We haven't eaten too much yet, so we're all conscious still. Okay, but our hearts are doing this, and most of the time, each and every time, it works sufficiently to perfuse blood through the body. Okay. However, as Maxine had mentioned, cardiovascular disease is the #1 cause of death in this country of both male and female, and most of the time, that's due to sudden cardiac arrest, where the heart is not doing this. It's chaotic. In fact, most of the time, it's due to ventricular fibrillation. Okay. The heart is chaotic like this. The electrical rhythm has been disturbed. It's not receiving the electrical signal here and being transferred correctly. It's chaotic. It's doing this. That's a non-perfusing rhythm. And if that were to happen to me right now, I would collapse. I would have no response. I would be unresponsive. I might not be breathing or gasping for a breath every few seconds. That is not a sign of life if I'm gasping for a breath. I would also have no pulse that you could detect. Okay, so that is a perceived medical emergency, which Maxine mentioned. You need to call 911 first, which is printed right on the unit here. Call 911. So a person calls 911. Most of the time, it's going to be a team emergency response here. One person calls 911, one person grabs the unit, places it next to the patient's head, unzips the case, opens it up, lays it down just like this, and follows the voice prompts. Now, I'm going to demonstrate exactly what we do when someone's collapsed. Someone's collapsed, they're unresponsive. They do not have a pulse that you can detect, they're not breathing, or they might be gasping for a breath. Again, someone's called 911, we've made sure that person called 911, and we've grabbed the unit, we've placed it next to the patient's head, we're going to unzip the case and listen to the voice prompts.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
And we've done that.
When patient's chest is bare, remove protective cover and take out white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
And that's 1 time down and up for each noise, just like this.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Now, what we've done is we found someone in cardiac arrest, possibly in cardiac arrest. We pulled the green handle, we placed the pads on the patient, and we listened to the voice prompts. What you want to think about is getting a shock to that person as quick as possible.
Begin by place pad exactly as shown in the picture. Press firmly to patient's. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Shock delivered.
Now that's how fast you really should deliver a shock. If someone's in cardiac arrest, their life depends on it. You're going to be calling 911, and you're going to be relying on the EMS personnel to come and help you out here. But again, you only have, I say 10 or 12 minutes of no treatment. Now, only a few minutes here of no treatment where brain death will occur. Some brain damage will occur just in a few minutes. By 5 or 6 minutes or so, that's really getting into a critical stage here. This unit has what's called smart pads. The pads cartridge has a diagram here of where to place the pads on the patient. It's also connected here with a couple of electrical points where it actually senses, of course, if I pull the green handle, if I place one pad on a patient and I place the other pad on the same patient. So you need a conductive surface, which I'll go over in a minute here. It could be one of you, okay? You know, and one of your friends could be responding to you. And you might have just told that friend, ladies, you might have just told that friend that you just had this, wonderful bra that you either bought or was a gift to you that was a $125 bra, okay? Now, your friends, after you tell them that you spent so much money or someone spent so much money on that bra, hopefully they're going to cut it right off, okay? Because, you know, that's just slowing down the time where the shock's going to be most beneficial. So you can rely on this to save a life, okay? Don't be afraid to use this. Does everyone think they would use this in an emergency?